All right, welcome to another episode of Regen Med, the podcast. I'm Dr. Abraham,
And I'm Lindsay.
and we're going to be talking about all things that have to do with Regen Med, with health optimization, and anything else that's, somewhat health related that you guys want us to talk about.
So, to get started, I think a good question to ask you is a question I ask myself. Um, I give my version of the answer to this, and I want to know what your version of the answer to this is. So, the question is, what is regenerative medicine in your words? What does it mean? What does it entail?
What's regenerative? Okay, great question, obviously. I mean, it's after all the Regen Med podcast. Uh, to me, regenerative medicine, the word regenerative is key there. Anything that's going to help um, regenerate tissue, anything that's going to help reverse some of the signs of disease or aging and kind of work at its core. Uh, like the way I like to think about it, there's kind of like different subcategories almost of regenerative medicine. So whether it's something like anti-aging therapy or again healing, regenerating tissue, like we see that a lot with joint repair. And to me, honestly, health optimization. I don't know. That's if that how that fits exactly under regenerative. Like in other words, some people might not necessarily place that under regenerative medicine, but I do think health optimization is part of regenerative medicine because if you think about it, the reason many times our health is not optimal is because maybe our diet, our exercise, our physical activity, I should say, isn't optimal. So if we're not living an optimal life in terms of our bodies, it's probably because of the things we've done, some of the choices we've made for one reason or another. So if we can help optimize that, to me that does fall under the category of medicine in general, and I think one of the best places to put it is under regenerative medicine.
So, for those that don't know exactly specifically what regenerative medicine means, um, it's just using your own body to heal and repair your own body. Like if you cut your arm and you don't put anything on it, your body's going to heal itself. So, with that being said, with regenerative medicine, we also can utilize it, like you said, in anti-aging. So for someone that's looking to, reverse aging and maintain a more youthful appearance, they can literally use their own plasma and stimulate those cells to, reproduce and grow new, healthier cells that will then make them appear more youthful. So going into that, you were at the aesthetic show and you were on the panel.
For sure. And just before, because I do want to make a little comment about that. I think the kind of definition you gave of regenerative medicine is, in a way, more of the like technical definition. I think that's a place where regenerative medicine it's definitely included under regenerative medicine. But I think in practice, and to me, regenerative medicine includes that and a bit more. So it's not necessarily about, again, like for example, the use of plasma and PRP is a great example of that to help like repair tissue. But a lot of times we're also talking about regenerative medicine. Again, we're talking about things like anti-aging, whether it's like IV vitamin therapy or you were just starting to mention some of the aesthetic stuff that can sometimes also fall, or regenerative medicine has a role that it can play there. So I do think it has to do with kind of repairing the tissue and seeing what your body can do in using that, but I do think it also goes way beyond that into other avenues as well. So I just want to
Like
make that quick
utilizing
note.
vitamins, is that what you're saying? Like,
I think it has to do with what I was saying is, again, at least to me and how many people practice it's about health optimization. So it's
okay.
optimizing whether your nutrients. I mean, we talk sometimes about like diets and things like that, and things you can do to kind of help reverse aging. So reversing the signs of aging, for example, I think is a good example of regenerative medicine where it's not necessarily a problem like an injury kind of problem. So it's not like, in other words, regenerative medicine isn't specific to like certain injuries. I mean, it definitely works there and it's great there, and that's part of what it does, repair injuries. but it also again goes more into the optimization of health. Like how can you, again, as simple as asking questions like how can you optimize your diet, to kind of live the most optimal way. Now that's kind of like the basic. It's not really um, it's not necessarily the medical. You're not like going too much into the medical there, because you can do a lot of a lot of these things you can do at home. uh, but yeah, I just wanted to make that note, because again, it's more than just
So it's
healing
not
injuries.
just about the process of, because I understood it
Mhm.
as this, you're using your own body to heal your own body. So it goes beyond that. It's actually external. You can do things outside your body.
Sure, and it's also using your own body to optimize your body, not just to heal your body. I think when we say heal, like we assume some kind of injury
Okay.
that has to be done. So I think, yeah, one way to say is to heal it when there's an injury, and to optimize it even if there isn't like any specific injury.
Okay.
And some people might not agree with this definition. It's just the way, because you asked like how do I see it.
Right.
That's how I see it, and that's how I think a lot of people see and practice it. For now,
So it's
so
not
yeah.
like black and white. It's a very wide range of things,
Yeah.
and you take in all things, not just very like linear with the definition. Like when you literally type it into Google, it'll give you this textbook definition of what
Exactly.
it is, and you're saying it's
Beyond
beyond
that,
that.
for
Okay.
sure, 100%. Yeah.
All right. Well, and then swinging into anti-aging, I just wanted to touch on anti-aging because it's like my passion. I'm an esthetician and I'm trying to stay youthful forever. And so I personally have done the biofiller, and I didn't want to do standard fillers for my own personal reasons. So going into that option that not a lot of people are aware of, at the aesthetic show, it was highlighted a lot, and a lot of the doctors that were on the panel with you and yourself had mentioned this
Yeah.
different new type of treatment. Um, Kind of, I guess, explain what it really does for your skin and for your like anti-aging, and why we use it in the face specifically, and I guess, yeah, like what does it do for you?
Yeah, so you've mentioned the aesthetic show a couple times. So just for our viewers, the aesthetic show is a show that happens in Vegas once a year, and usually thousands of providers go there, and we talk about all the latest and newest in the aesthetic field. But also, especially this year, there's a lot of talk about the regenerative and anti-aging medicine, and I do think that there's a lot of commonalities there, again, because the regenerative medicine is such a big field. And I think uh, in all aspects of medicine, people are starting to use regenerative principles more often. So whether it's in orthopedics, or whether it's in cardiovascular, or whether it's any sort of medicine, I think people are starting to look at regenerative medicine and these principles and incorporate them more often. And the aesthetic field is definitely one of these fields. So biofiller, which is what you're talking about, are basically where we utilize your plasma again, and there's a couple ways to do it, but typically speaking, it's the utilization of your own blood to kind of uh, take out the platelet-rich plasma, which is rich in growth factors and cytokines, and then we kind of process it in a way to make it more into a gel-like substance, so that it has a similar consistency to what you see in filler, and then we re-inject it in the face. And the idea behind that is that it can give a more natural look, because it's gonna be able to integrate with your tissue a lot easier, but it's also gonna be releasing all these growth factors and cytokines that are gonna help with your tissue repair, tissue regeneration. Again, that word uh, comes up again. And so this is also a place where we do see a cross between aesthetic medicine and regenerative medicine. And we do a lot of aesthetic stuff here. I do believe that the aesthetic field is actually one of the fields where there's a lot of room for regenerative medicine, where a lot of um, that advancement is happening. Uh, and I do see it moving more and more into that direction.
Yeah. I mean, I honestly, that's why I chose the biofiller route, because I felt like I would rather utilize something that I have within myself than do a filler. I mean, nothing against fillers because I have them as well.
It sounds
Don't
better,
get me
right?
wrong.
It doesn't. It's just like you're using your own tissue, right? And again, like you said, we use fillers here and stuff too, and I think there's definitely a place for both. But it makes sense, right? It does sound better. It makes sense that if you can use something that's more in line with your own body, with your own tissue, uh, it's definitely worth considering. Again, sometimes we do have to use external help too, and there's absolutely nothing wrong with that. But there's more utilization now of more kind of, again, your own tissue, your own products.
Yeah.
For
And then
helping
people
that.
would ask, like, what's in it? I'm like, it's just literally just your blood, your plasma, that's it. And then there's no side effects really because it's your plasma. And yeah,
I
that's
mean, everything has side effects in medicine, even regenerative medicine, but I would say it's minimal. I mean, you can never say never or zero, but it's definitely minimal. I mean,
minimal.
I can't remember the last time anybody had a problem
No.
with like any significant
And
problem.
honestly, like more people now are wanting to look more natural and
Mm-hmm.
less fake or too full. And it's nice to have that conversation with someone and they go, "Wow, you look so great." And it's not like, "Oh, what did you do?" Not like, no, they don't know what you did. You just look more refreshed. And I guess that's where something like that would come into play and give that look.
And just to kind of tie it up to what we were talking, a minute ago about like what regenerative medicine is and how it has all these different fields under it, at least in my view, whether it's anti-aging or aesthetic or tissue repair. I mean, because you are in a way like regenerating, your tissue, repairing that tissue, it's of course it's gonna look more natural. Because we are reversing some of these things that have happened with aging, and that's again where aesthetic and anti-agings are connected. A lot of times when people are thinking of aesthetic medicine, they're thinking, specifically, okay, it's doing that laser or doing this injection to change the way I look, and it doesn't have to be to change the way you look. This is where again regenerative medicine can come in, and if you can, I think anybody, if you ask them, if like, hey, if we can do something and reverse the way maybe your skin looked and kind of make you look, 5, 10, like just kind of bring it back to closer to what it looked like 5, 10 years ago, then yeah, I think most people would sign up for that, right? Just because again, you're not necessarily changing anything, you're not adding anything external, you're just trying to reverse some of that process of aging as best as you can.
And then combining that obviously with everything else that you do just makes it a full, you know,
Yeah.
plate of options for
That
people.
was actually the exact topic that I was presenting at the aesthetic show. Is stacks? It was called Stacks on Stacks on Stacks, and it was talking specifically about combining, different medications. So, I think the regenerative field still has ways to go. I think it made a lot of advancement lately, but we still have a lot, to go. And I think we still have to. The best way to do it is just to be aware of all these options and sometimes you do have to do combinations of different treatments
Mm-hmm.
to kind of get the best results.
Yeah, for sure. And, not every person is the same and everyone has like customized things that they need. Like some people have more volume loss than others. And I don't think biofiller is going to always be the best choice
Exactly.
for that specific thing.
You're right.
But it's fun that we have all these different options and that we can play around with, regenerative medicine and then, the other,
Yeah, the other
the
option
other
as well.
options. um, and then with the stacks on stacks, also it's literally combining. I think you guys were combining PRP with Sculptra.
There's a few
That's a
different
popular thing.
combinations that we've talked about. We've definitely mentioned PRP with Sculptra. Dr. Raj was there, Dr. Rajani was there, and he was one of the, um, you know, he's at the front of that field in terms of talking about Sculptra and PRP, and he's responsible for bringing that idea to many people in the market. So as it's great to be able to share the stage with him and kind of learn from his experience as well. But the combination of PRP with treatments like Sculptra, they are also meant to be biostimulant. Biostimulant meanings bio is from the word biology, and stimulant, stimulating your biology. So they're meant to produce collagen. So it's kind of taking these different treatments that are meant to help your body in different ways and combining them together. Um, so yeah, I've talked a little bit about it. Dr. Rajani talked a little bit more about it as well, and it was great. I loved it. It was a great conversation that we've had. There's a lot of amazing providers there as well too, that we got to share all these ideas with each other, and then talk about all these different topics.
And then also, I guess, like, for me, when I think of Sculptra and PRP mixed, I guess, is it like doubling down on your bet? It's like, we're already doing this. We have access to this. Let's combine the two and kind of, hyper stimulate the area since we're there.
Yeah, well, I mean, they work by different mechanisms, so it's kind of like, yeah, stacking the treatments to get more optimal results. Because unfortunately, when we age, it's not just one thing that happens, right? It's for example, if we're talking about the aesthetic part, just to kind of keep going with that same idea. If we're talking about aesthetic, then the skin gets thinner. We also lose collagen. The fat is we get like fat repositioning in the face, where we lose fat in some areas, and then we gain it in other areas. There's some bone remodeling that's happening. So it's not just one thing, right? It's not like, oh, when you age you get wrinkles, and that's like, if you fix a wrinkle, you've fixed every problem in terms of the aging and aesthetic. So there are different things that happen, and that's why there's also, like, again, different modalities to treat these different issues. And if you can stack few modalities, that way you can address more than one problem. So if you can just help, again, like we said, for example, the skin gets thinner. If we can make the skin thicker, that's gonna improve the way it looks. But you still have kind of that fat repositioning, and you have extra fat in one area and less in other areas. For example, you might have heavier jowls but less volume in your cheeks, just for example. But if we can, help with that, and at the same time help with making the skin thicker again, and at the same time help with the reproduction of collagen to make up for that lost collagen, and then we're going to get a much kind of more comprehensive, much better results than if we just go after only one thing. So.
Right. I think that's important too, because people come in with this idea in their head, like, okay, I want filler. And it's like, well, actually, your problem is, yes, you have a volume loss, but you are also, the skin texture and the overall appearance, the dullness of the skin, and the loss of elasticity in the skin. And you might be hyper focusing on one thing, but then if you just do that one thing, everything else is going to be a lot more noticeable and apparent. So I personally love stacking treatments and combining regenerative types of treatments, with our everyday cosmetic treatments.
And we'll end with this because I think we're out of time. But that also allows, when you stack these stuff, it allows for the personalization, right? Because everybody's a little different, and even though kind of like these things that we've mentioned happen to everybody, but they happen a little differently to everybody. Like some people, maybe the skin thinning isn't as much of an issue to them as the fat repositioning or the bone remodeling issue or some of the other issue, but for somebody else it is, or somebody just has a lot of like age spots on their skin from sun damage, and so we might want to do a different approach than, again, somebody who's not having any issues with skin discoloration, but they have issues with skin texture. Again, the details aren't the important thing here, but the point is, you also do want to personalize these treatment, again, to whatever the concern is, and whether we're talking about aesthetic medicine or whether we're talking about again, orthopedics, whether we're talking about anti-aging therapy, whether we're talking about joint pain or muscular pain or any other form of issue or concern the patient have. It's always, the idea is, the more options you have and the safer options you have, the better of a plan you might be able to come up with.
Wow. That's impressive. That's great, though. That's great. That's the best part about all of this, I guess.
Awesome. Well, I think maybe we'll end here, and then yeah, we'll hopefully see you guys at the next episode.
See you later.